So I'm going to speak upon a very important topic, what we call vascular health. Anybody in the audience, can they tell me what is the most common cause of death? From which we all fear in the world. What is the most common cause of death in the world? Heart attack, So everybody knows about this. So the most common cause of death is a cardiovascular death. But people are more afraid of AIDS, cancer, road traffic accidents, but they never take care about the cardiovascular health, which is actually in our own hands. We can control it ourselves, sitting at home. You don't need to go to the hospitals. So I'm going to talk about a very important topic today, and which is going to touch up everybody out here. And actually, it's going to affect your homes, your families, and your children. So I'm going to take you around in another 15 to 20 minutes what I'm going to talk about that. Now, the number of deaths by cause in the world, and you can look into this, around 18% of the deaths, 18 million people die because of cardiovascular death. Cardiovascular death means the blood vessels, the pipes which run into our body. It's not only the heart, it's the pipes which are run in our body. They get blocked or they rupture and we die. The most common cause is, as the gentleman said, heart attack. And the second most common cause is a stroke. Once you get a block in the arteries in the neck or in the brain. The third important cause is the kidney failure. We are the leading kidney failure country in the world. If you look into the cardiovascular death rate, look into this. Most of the developed world has got the control on the cardiovascular death because they started working on this 50 years back. And we still haven't started it. So that's why if you look into most of the developing countries will have the higher mortality. They will die more as compared to the other countries. If you're going to think about that, you're going to have a heart attack or a stroke, and then you're going to start a prevention, you're too late. You're gone. Okay? So you need to run faster. So you need to think faster. You need to develop the things which are much more important than the things out there. I'm going to start from the very basic because, a lot of people are not doctors here. So what we are talking about, all these blood vessels in our body, the blue and the red lines, which we all think about. So these are very, very important parts in our body. This sign, I got this from one of the restaurants. It's a very important sign. It says that you have a normal ECG here, and once you start reaching McDonald's, pizzas, your ECG becomes bad. And of course, this is a very important, simple thing that if you eat a high-fat diet, it can create a lot of problems. Now, this picture I clicked 18 years back in Panchkula, local out here. It's a beggar. He actually went to the shop there and bought a burger. It was 8 rupees. And now burger, if he eats for 8 rupees, it can actually fill his tummy throughout the day. But of course, it's not good for him. So if you look into this, the fast food is much cheaper as compared to a normal healthy diet. And it is much filling, and of course, it's more tastier. And that's why our kids wants to eat pizzas and burgers all the day. So that's the biggest problem what we have, that you cannot convince your kids to have a normal Indian meal. And you know one thing, the normal Indian meal, what we eat at home, is the best meal medically in the world. It's in the top of the chart. But we don't realize this because we are not, we always follow the West. That's the biggest problem. So lipids. So lipids mean, layman terms mean the fat. That's the biggest drawback in the world. I actually have heard few celebrities saying, I'm speaking in Hindi, रोज घी खाओ कोई फर्क नहीं पड़ता मैं 25 चम्मच घी रोज खाता हूँ बहुत अच्छा रहता हूँ okay please so we can discuss it in detail but please if the celebrities start talking about the health issues and start talking about the medical issues then it's a very drawback at the same time advantage if they talk logically and scientifically. But if they start talking about one individual person, talking about like this, and this is not the statistically, which is because the people will follow it. The celebrities are very important for us because they are the people whom the people hear. They don't listen to the doctor. If the doctor says don't eat, they say doctor to bolta hi rehta hai. No, koi bhi nahi sunta hai. If we tell people to stop smoking, nobody stops. But if the celebrity says smoking is bad for your health, you'll see more than 1,000 people will stop on the same day. So that's the effect of the celebrities in the world. Smoking. Coming to smoking is a very important bad effect. Hypertension. So take less stress, guys. Everything is cool. You can't change the world. You can't change the things which you cannot do it, which are beyond your points. So just relax a bit. Diabetes is a very important topic. As you know, diabetes is high blood sugar in our body. Now, we are the diabetic capital of the world. And the reason for that is because we eat more and less exercise. It's very simple. And along with some genetics, which we think are also playing a role in our country. Now, once we have the diabetic capital of the world, what that means is we will have all the diabetic related issues in our world. And you're going to hear that soon. Now, this picture is very important. It's written small, but look into this. So we have got this picture where here we are in India. So we have got around 82 million diabetics, and we will have a rise of 151 millions by 2045. Means double the rise. So means, what it means is we are going to have a huge problem with diabetic related issues in the future if we don't start acting now. So look into the Western world. What they have done is, I was trained in UK, and what they were doing was they were already doing a lot of preventive lectures, lot of talks like this to teach the people that please, you should not have diabetes. You should not have diabetes. Exercise every day. They put in the machines, the gyms in the office, and make the people work a gym half an hour, sports in the office, in the corporate. So I give a lot of corporate lectures and teach them that the one thing you should do is make a small area of gym in the office, and so that people come and do an exercise whenever they free time. Actually talking, you will save more money in the future because your employees will take less sick leaves. It's a very broad, futuristic thinking which people needs to do. It's not about just keep on sitting on the desk and work, because people are going to take leave because of back pain, shoulder pains, headaches, a lot of issues which we are going to have. Now, this is a very important slide. Only rich people have diabetes, mainly. So that's why please don't earn too much money, because you will going to have problems later on, so that poor people have less diabetes. And it's very simple, because they do hard work, they eat less food, and they eat healthier diet. So that's a very important thing, so don't become rich, okay? Now, top 10 countries who spends the money on the prevention of the diabetes. Of course, we will be very backward, because we spend, how much GDP we spend? Guys? Only 2% max. And the developed world spends 7 to 8% of the GDP, which is a huge, and that's what we need at present in our country, because we don't have prevention things. We are building the hospitals to treat. But the amount of population what we have is we cannot get away with treatment. We don't have enough doctors, hospitals, which we can treat the patients. We need to get onto the preventive mode, and which we are actually talking. If you look into the system, we are hardly hear any preventive things in the world. Hardly in the newspapers, in the news, anywhere. If you look into it, there are hardly any prevention talks that how we can prevent. International Diabetic Federation is a body who works on the diabetes, because the most common cause of death in the world is diabetes now. Now, every 10 seconds, one person dies of diabetes. Now, that's a very important statement in the world. Look into this. Every 10 seconds, 2 people develop diabetes. Each year, 7 million people develop diabetes. 7 million means 70 lakhs. If you look into the global cause of disability, so diabetes is a very, very important component which is killing the people all across the world. Look into the prevalence in India. We used to be 7% people diabetic. Now it has gone to 9%. And we think it's going to be 14%. What that means is 14 people out of 100 will have a diabetes. So that's a huge, huge number. If you look into the state-wise, Chandigarh is at the top of the list. Okay? It's 14% is already diabetic people in Chandigarh. And the reason for that is because we are wealthier people in Chandigarh, and we eat quite a lot, and we party a lot, we drink a lot. And so these are the reasons. And genetic could be a social factor, which could be playing a factor here also. But we don't have the studies to show does the genetics play a role out here or not. There are a lot of myths that diabetics only causes heart disease. Guys, diabetes means it will block the blood vessels all throughout the body, from top to bottom. It's not only the heart. So you will have 50% of the people with diabetes will have heart attack in their lifetime. So that's a huge number. 10% of the people will have their eyes gone. So you should know that a diabetic retinopathy, we have the largest in the world. Highest amount of the retinopathy. Kidney failure. Around 20% will have kidney failure. So we have got the largest number of kidney failure patients in the world. So we are actually number one in a lot of things. Foot ulcerations. We also got the largest numbers of diabetic foot in the world. And there was a study published from Delhi recently that one of the major causes of death in diabetes is because of the diabetic foot. And because what happens is when you have diabetes, it blocks your blood vessels in the legs and it causes a diabetic foot and you get an amputation. The moment your leg cuts off, you get amputated, you don't walk and your heart does not work. And it's a spiral thing. Your sugar goes up and you gets a heart attack. So it's a very spiraling thing. So foot ulceration is a very important topic. If you look into this, the diabetic foot ulcers in India, 80% of all the amputations in the country are because of the diabetes. So one we know from this talk that diabetes is bad for us, you know. So the aim should not be the treatment because that's we are missed the battle and we have missed the boat. Aim should be prevention, and prevention can only be done by education. So here comes the important talk: how we can reduce the risks fast. One is we should not smoke. That's very very clear. Less alcohol intake, eat very healthy, and we must exercise around 30 minutes every day. Now, feet are very precious and we must preserve them. I'm going to give you some tips here, last two topics, how we can save our feet if we have diabetes. It's only for the diabetic people. So anybody of you who knows any diabetic patients, please pass on these messages to them because we can't go everywhere. There are a lot of things on the internet. We must not let them dry. In diabetes, because of neuropathy, your feet becomes dry. So we must put them a moisturizing lotion. The diabetic patients cannot see their feet because of the blindness and also because of they cannot bend too much. So they should see their feet by a mirror and so that there is nothing inside there because they could have a stone in the foot, in the shoe, and they could wear the shoe and could walk around because they will not have any pain because of the neuropathy. Second is they will develop these corns. So please tell them not to do it because people start taking the blade at home, they start excising themselves. So because they see on the YouTubes. So please don't do it yourself because it can get infected. And should clean in between the toes. Cleaning of the toes in between is very important because otherwise you'll get a fungal infection and the infection spreads. Second is moisturizing lotion is very important. They should apply it every day. Nail care is very important. They should cut the nails absolutely in the straight form and not in the curved form. Just like we all want the nails to be like this, not like that, okay? And the reason is because if you do it in the curved form, they can have an injury out here. And this is very bad for the diabetic patients, which we should not happen. Please do not do the following. Do not soak the feet in the water. Because once you get a neuropathic pain, the first advice every doctor gives is, garam pani lena, uske andar pair dal dena. Now this is the worst thing you can do because you don't feel the heatness of the water, you cannot control. So you will have burn. So we see more than 30 patients a year only by this, just by this complications. And out of 35 will lose their leg just by soaking into the water. So please, it's very, very important. Never walk barefoot because you don't feel anything, you don't feel the temperature, you cannot feel the pins and the needles out there on the floor, so you can injure your feet. When you buy the new shoes, buy in the afternoon because in the morning the feet is small and the evening the feet is bigger. So how will you size the shoe? So always try to buy it in the afternoon where the shoe will be absolutely sized according to your feet. Now this is one of the very important slides everybody must read. Now everybody I think knows about it, but we don't follow it. Now I will put in 1 minute on this slide because it's very important. Now these are the things, which are to be lowered down. In nutshell, anything, I put in a principle at my home, anything which is stored, anything which is preserved in bottles, in packings and everything, should not be eaten at home. This is my very simple principle we follow, because that will contain preservatives, high salt or high sugar. Because that's the only way you can preserve something, And all preservatives, as you know, are carcinogenic. So you will see, if you read all the booklet, anything, you take chips or anything, take a photograph at the back, see the constituents, and read about the constituents. You will never touch a chips packet again, okay? Anything you take. But nobody reads the back end because nobody has time. We must eat whatever is grown in the sand, which is very good, or in the trees, of fresh fruits or vegetables or anything which is there. Now, saturated fat is very important because we should not eat as less as possible. Polyunsaturated fat, because it has got bad lipids are LDL and good lipids are HDL. So both are lower in this. So these type of oils at home should not be used at all because it is bad from both angles. Monosaturated fats means these are best because you get best lipids and the bad lipids are the lowest. So at home, we should try to use only these type of oils if possible. Now, good rule of thumb is any fat which is solid at room temperature, like a butter, ghee, is not good for us. Any fat which is liquid in the room temperature, like a vegetable oils or anything, they are good for us, in nutshell. Now, it's a very important topic. A lot of people ask us how much alcohol we can take. Because wherever we go, people ask us. And alcohol is a very important topic. Now, this is the amount of alcohol which is published in the world, which alcohol is bad, okay? I'm not promoting alcohol, but alcohol is absolutely bad. But if you have to drink, then don't drink more than this. So more than 14 units of alcohol a week, 6 glasses of wine a week, and 14 single shots of spirits. So don't try to drink more than this alcohol per week because that can be bad for your health.